Many people think that the most important factor determining your cancer risk is inherited, coming down through the family. But we know that about half of cancer risk can be affected by lifestyle. And in fact, after smoking, the most important preventable factors are to do with body weight, physical activity, and diet. WCRF has identified 13 cancers that have been related to diet, physical activity and body weight, and amongst those are the commonest ones we find in the UK. That's things like breast cancer, bowel cancer, prostate cancer, cancer of the womb, and so on. And so much of the misery that comes from having those cancer diagnoses and the treatment and even the deaths that follow them could be prevented by having a healthy lifestyle. Really, there are lots of cancer cases that can be prevented. It's about a third of the commonest cancers in the UK, and that comes to over 80,000 every year in the UK alone. In terms of body weight and physical activity, obviously they're related to each other, and so we recommend that people are a healthy weight, that they are physically active as part of everyday life, and to avoid those foods and drinks that tend to make you gain weight, in particular sugary drinks and fatty foods. Then the broad balance of the diet, we recommend that it should be a plant-based diet and a modest amount of red meat and avoiding as far as possible processed meat. Not to have alcohol for cancer, and to not have too much in the way of salt either. We do say, as I said, to avoid dietary supplements for cancer prevention because they can have unexpected effects. And if you can, breastfeed your baby. It's good for the mother and it's good for the baby. Having a healthy diet that's based around plant foods, whole grain cereals, pulses, vegetables and fruits tends to be one that's lower in calories and helps you maintain a healthy weight. And the second is that those healthy plant foods do contain certain substances that can help to protect you against some of the cancers, particularly those of the throat and mouth and lung and so on. Being a healthy weight is probably the most important thing you can do after not smoking to help protect yourself against cancer. Being overweight can affect the metabolism in a way that makes cancer more likely to develop. If you're a woman, for instance, being overweight tends to increase the levels of the hormone estrogen, and those estrogens can promote the growth of some cancers, particularly breast cancer, but also womb cancer. It can also produce more general growth hormones that tend to create an environment which also makes cancer more likely to develop. Physical activity is important for helping prevent against cancer for two reasons. One is because the more physically active you are, the more likely you are to stay a healthy weight, and being a healthy weight is important for cancer prevention. But also, independently of its effect on body weight, it has effects on the hormones that tend to make the body less likely to develop cancer. It's advice from a group of internationally renowned experts over several years who've reviewed really thoroughly the whole body of scientific literature. And so we're not talking about one individual study, we're talking about thousands of studies that have been reviewed and pulled together and interpreted in the most robust possible way.